What would you do if you were in your mid-20s? You had already had a spinal fusion in your low back, you fell on your rear, and then all of a sudden ended up with a chronically and constantly numb right leg with pinching in your low back. My name is Dr. Zach Ward. I am the structural and upper cervical chiropractor here at Life and Alignment Chiropractic here in Auburn Hills, Michigan. I wanted to make a quick clinical video for you. This is me in the upper left corner about a young man and his experience here in the office using the unique chiropractic methods that we have to bring the body back up on the vertical axis and take pressure off the spinal column, spinal system. So let's go ahead and pretend that this is the patient. This is where the leg numbness was here. This is where the spinal fusion was. And this is what his structure and his posture look like. Hopefully you'll be able to see that image to your right of the screen and how he has got a low shoulder. He looks compressed on this right side. His neck and his head are using that righting reflex to try to counterbalance back and bring him back up and keep him on the vertical axis. What did he look like after a few visits of working with me? He looked something like this. The shoulder that was low and compressed on this side popped up. The neck that was leaning over to the left came back to middle as his head rotation and lean came out. So overall, this compression that was happening on his right side into his right lower back was relieved through a light and gentle sustained pressure along this area here. Not any kind of quick snap, crackle, or pop. A little bit about the practice. What we're looking for is we're looking for the body to be on the vertical axis as much as possible, to be upright and open. We're looking for the ability to take out any rotation in the spinal column. We want the shoulders to be as level as possible, the hips to be as level as possible, and for the head to be centered over the shoulders and the hip. If distortion in any of these areas sounds like you or someone like you, or even if you have a history of spinal surgery or fusion, you're certainly welcome to go ahead and call the office instead of a free screening here at Life and Alignment Chiropractic. You can also go to the website, which is liachiro.com, and use the contact page. And we will set up a free screening opportunity. And we do that because what we do in the office is just so different than most people's experience. We have to go through an initial education process to, number one, make sure that we can help you, and to let you know that you're getting something different than at most chiropractic offices. So we'll talk about your situation for 15 minutes. You can ask me anything. We'll go ahead and screen you and see if you qualify. And if you have a solvable problem and you have some goals, then we'll go ahead and set that up and get you started with a full exam. Again, liachiro.com is the website. You can use the contact page. You can also call the number here. I am Dr. Zachary Ward here at Life and Alignment Chiropractic, your structural and upper cervical chiropractor in Auburn Hills, Michigan. Thank you for watching.